Today's, today's topic is normal labor. Definition: series of events that take place in the genital organ in an effort to expel the viable products of conception, fetus, placenta, and the membranes out of the womb through the vagina into the outer world is called labor. It occurs in 37 completed weeks. If prior to 37 weeks it is preterm labor, labor is characterized by presence of regular uterine contractions with effacement and dilation of cervix and fetal descent. A parturient is a patient in labor and pasteurization is the process of giving birth. Delivery is the expulsion or extraction of viable fetus out of womb. Delivery not synonymous with labor. Delivery may be vaginal, either spontaneous or aided, or it may be abdominal. Normal labor is also called ectosia. Labor is called normal if it fulfills the following criteria, which are spontaneous in onset and at term, with vertex presentation, without undue prolongation, natural termination with minimal aids, and without having any complication affecting health of mother or baby. Abnormal labor, which is also known as dystocia, any deviation from the definition of normal labor, thus labor in a case with presentation other than vertex, having some complication even with vertex presentation affecting the course of labor or modifying nature of termination or adversely affecting maternal or fetus prognosis. Date of onset of labor, it is calculated by Naegeli's formula. Based on formula, labor starts approximately on the expected date in 4%. Causes of onset of labor. First is uterine distension. It is stretching effect on myometrium by the growing fetus and liquorabni and can explain the onset of labor at least in twins or polyhydramnios. In the uterine stretch, increase the gap junction proteins and receptors for oxytocin and specific protein known as CAP. Fetoplazenta contribution, it is cascade of events which activate fetal hypothalamic pituitary adrenal to onset of labor. It leads to increased CRH and release of ACTH and act on fetal adrenals. It leads to increased cortisol secretion and accelerate production of estrogen and prostaglandins. Estrogen, it increases the release of oxytocin from maternal pituitary, promotes the synthesis of myometrial receptors for oxytocin and prostaglandins, and increasing gap junctions of myometrial cells, accelerate lysosomal disintegration, stimulate synthesis of myometric contractile protein, and increase excitability of myometrium. Coming to progesterone, it increases fetal production of dehydroepiandrosterone sulfate and cortisol and inhibit conversion of fetal pregnenolone to progesterone. Progesterone levels therefore falls before labor. It is alteration in the estrogen progesterone ratio rather than the fall in the absolute concentration of progesterone, which is linked with prostaglandin synthesis. Coming to prostaglandins, they are important factors which initiate and maintains labor. Major sites are amnion, chorion, deciduous cells, and myometrium. Synthesis is triggered by rise in estrogen level, glucocorticoids, and mechanical stretching. Prostaglandins enhance gap junction formation.